Welcome to My Life on a GLP1, the podcast where we dive into the real, sometimes hilarious, and often unexpected journey of navigating GLP1 medications. I'm your host, Scott Johnson.
And I'm Sarah, joining Scott today to explore some truly unique experiences.
That's right, Sarah. Today we're unpacking a moment that many of you might relate to, even if your doctor hasn't quite put it this way, being called the poster child for weird. It all stems from a recent 2-year checkup that took an unexpected turn.
Oh, I know the routine checkup. You go in, expect to be in and out, maybe a blood pressure check, clean bill of health, but this sounds like it went off script.
Completely off script. Imagine sitting there, expecting the usual, and your doctor is just staring at your chart like it's an unsolved mystery. Then he looks up and says, "You know what? You might just be the poster child for weird."
Most people would be offended, but knowing you, you probably grabbed a notebook.
You know me too well. Exactly. I started taking notes because, frankly, the journey on GLP-1s, starting with Mounjaro and then Zepbound, has been anything but conventional. The marketing materials definitely don't prepare you for your body becoming a walking collection of the most unusual side effects ever documented.
You're talking beyond the typical decreased appetite or occasional nausea, right?
Oh, way beyond. We're talking about conversations with medical professionals that sound utterly absurd, like trying to maintain your dignity while asking if dry heaving at the mere scent of toasted bread is normal, or explaining that your burps have somehow developed a barbecue sauce aroma even though you haven't touched barbecue in weeks.
Barbecue burps? That's specific. I thought I'd heard it all with GLP-1s, but that's a new one for me. What else made the weird list?
So many things. The mysterious case of the left eyebrow itching exclusively on Thursdays, vivid dreams with elaborate lettuce-based storylines, an emotional breakdown triggered by a squirrel eating a cracker on the lawn, and of course, the ever-random allodynia, that skin sensitivity. My body decided to get creative.
Lettuce Dreams, it sounds like a surreal comedy sketch. But these aren't just funny anecdotes, are they? There's a bigger picture.
Absolutely. My doctor calling me weird wasn't an insult, it was recognition. I'd become a case study in how uniquely individual bodies respond. He saw me as valuable, the patient who documented everything, who asked the uncomfortable questions, who showed up with color-coded symptom diaries. I was providing data points that could help others.
And that's so important because so many people with atypical side effects feel isolated or think they're overreacting. They minimize their experiences or worse, suffer in silence.
Exactly. But these strange symptoms aren't meaningless. They are data. They're your body communicating. Whether it's an aversion to the sound of an air fryer or getting emotionally moved by cleaning product commercials, these reactions deserve attention and documentation.
It's liberating to embrace that role, isn't it? Becoming the person others seek out in support groups because you've normalized the weird.
100%. It gives you the confidence to ask those questions others are too embarrassed to voice. And in turn, it creates space for other patients to share their unusual journeys without feeling ashamed. And you know me, Sarah. I have no problem saying the weird thing that everyone is thinking about, but too afraid to say themselves.
And that is what we love about you, Scott. So for anyone out there whose body is writing its own rules on GLP-1s, whose burps could be coded messages,
Welcome to the club. Own it. Document it. Your weirdness matters because it's authentic human experience. It helps paint a more complete picture of what these medications can truly do.
and that understanding is crucial for the whole medical community.
In the end, being called the poster child for weird is a compliment. It means you're paying attention to your body, engaging in your healthcare, and providing valuable information. The GLP-1 journey is about much more than just numbers on a scale. It's about learning to listen to your body, even when it's speaking a language you've never heard before.
It's about trusting your own experiences, even if they don't match the textbook.
Precisely. So, to all the medically weird patients out there, your experiences matter, your strange symptoms deserve attention. And if you want to read more about all of my weirdness, you can check out my new book, My Life on GLP1: The Honest, Hilarious, and Gassy Truth About Losing Weight and Finding Myself.
That title makes even more sense to me now. Seriously, folks, it is an easy read, and I guarantee you will say "me too" a dozen times while reading it. So while you are adding it to your Amazon cart, I want to thank you all for your support of us. We encourage you to kindly leave us a 5-star review on our podcast and share with friends and family. Tell us, Scott, are you officially allowing us to call you weird moving forward?
Hey, why not? You bet. I am embracing the weird. It has taken me 2 years to go through this weird and wonderful transformation. I think we should all embrace it. And to our listeners, thank you for your continued support of our podcast, website, and embracing my new book. Please don't forget to leave an Amazon review creatively using the word burp. Thanks for joining us today. On behalf of Sarah, I'm Scott Johnson, reminding you to embrace yourself and your weirdness and always love your journey.